welcome everyone. Hopefully you are enjoying the conference so far. The sessions look amazing and really excited to connect with some folks. This is my first time doing a conference via Whova, so yay, new experiences, woohoo. Stacey has had some experience with it before, so I'm glad and we can kind of lean on each other. My name is Kate Barrow. I'm a community engagement specialist with the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services with the North Carolina Department of Health and Human Services. We are joining you. I'm outside of Raleigh, and Stacey is outside of
Winston-Salem.
So we're not even in proximity to each other right now. So this presentation is called Empathy and Affirmation. On the agenda for you all, it should have said Advocacy, Empathy and Affirmation, and I apologize, I forgot to add that first word, advocacy, to my title slide. But this is really about how we fostered youth empowerment during the COVID-19 pandemic and how we can do that beyond this time. Stacey is also a community engagement specialist. So welcome. So what we hope you take away today, by the end of this session, we hope that you have some innovative ideas. Where we started with this idea of a teen town hall or a youth town hall, hopefully that will spark some creativity for you in what you're doing to engage with youth and young adults. And sorry, I'm moving my screen around. We're going to talk about the process of developing this particular event, leadership and advocacy opportunities for youth and young adults. We're going to go through what we called finding flexibility. Much like 2020 and 2021, we had to find a place of flexibility when we were engaging with youth for this event. The objective will review how the planning committee had to modify and adapt methods for inclusion of youth peer supports in order to foster ethical engagement of youth advocacy and action. I'm going to show you a clip. We can't show you the full hour and a half that is beyond the time frame for this presentation today. You will find a link to that in this PDF copy you'll receive, as well as in the chat from Whova. I put the link in there, so if you wanted to watch the full hour and a half, you're welcome to do that. Highly encourage it because there were some really pivotal moments, and it was really hard to pick just one. We're also going to talk about actionable authenticity, and what this really looks at is, oh, did I switch slides? I'm sorry. When we talk about actionable authenticity, what we're really talking about is how can we elevate the voice of youth going forward and in their own communities, not just from this particular event, but from events going forward. And then finally, we're going to have some reflection time. We're going to discuss some of the things that going back to that flexible moment, and really reflect on what went well during the teen town hall and what we could have done better or differently, and what we're really looking forward to doing going forward with additional events. Now we can go here. So what was our why? We like to answer these questions when we're doing these types of presentations. Our biggest why was that we recognized pretty early on that youth and teens, especially our middle school to high school, and just that class that was graduating and going on into their first year of college, were really impacted by the pandemic, and we're experiencing higher levels of anxiety, depression, and suicidal ideation. And we wanted to really give them a platform and a place to talk about that, while also providing a safety net. We knew that this was a common experience, but we didn't know how common. And obviously that's kind of real-time data that we were looking to collect. It started out really as a directive that came from our executive leadership. You know, these articles that were posted across the country about youth mental health, and it came down from the top. Our secretary, deputy secretary for our department said, "Hey, let's do this teen town hall." Great idea. What we ended up, we'll get through kind of where we landed with that, but what we needed to do was kind of identify who are the key players in our community that can help connect us to youth who would be willing to participate, and how were we going to set this up. So the first thing that we did was we really identified any non-government agency and even some agencies within state government that could help us across the service sector. So not just with youth who already identify as having mental health issues or behavioral health issues, but also youth who identified as having developmental disabilities or neurodevelopmental disabilities. And how would we reach those folks? And then how would we also get youth to join the town hall and be the primary participants? Excuse me. So we needed to do a lot of research and a lot of connections across these different sectors. We wanted to ensure that those that were represented were not just representing mental health, but really inclusive of all youth. We were thinking in terms of, okay, we know we're going to have youth that have mental health and maybe some who identify as in recovery or on their recovery journey from substance use disorder. How can we be inclusive without outing a youth or without putting them in a place where they would be vulnerable? I'm going to pass it over to Stacey, who's going to talk about accessibility and inclusion.
So thanks, Kate. So one of the areas that we really had to focus in on was accessibility. In North Carolina, we go from beaches to mountains and flat land. So we needed to make sure that it was accessible to all teens and to all youth, which is kind of hard in our state because up in the mountains, there are people that don't have Wi-Fi. But we've been working hard on this for the last 2 years. So you got to make sure that as you're developing, if you're developing a teen town hall, these are things that you look at. Do they have the equipment? Do they have the Wi-Fi, the bandwidth? Do they have the education to work with the platforms that you're going to be using? As Kate and I were thrown into the virtual world in about a 24-hour period, it's been a learning curve because everybody uses different platforms, from Zoom to WebEx to Teams to things. I found out 2 new ones the other day when I was teaching, and I was like, oh, didn't know about those. Mm-hmm. So just make sure that you're taking that into consideration. Another thing you need to really think about is scheduling. A lot of times we think we got to do this during our workday. Well, what's happening during our workday? Youth are in school. Youth are, they're in after school. Do they have practice? Do they have band practice? Do they have to get home to make sure that their little siblings have made it home because mom and dad are working, or mom's working, or dad's working, and they're the adults in the house until the parents can get home. So we have to make sure that we are taking all of those things into consideration and making it accessible to the youth, and not meeting our needs as adults, but meeting the needs of who we're reaching out to. We want to, you want to make sure that we're thinking of the youth in ways that probably we think about them, but we probably don't, because we've got our goals that we need to get done, and they need to fit into our life, but we actually need to turn around and fit into theirs. So it may be something that we have to do, work with the school and say, hey, can we do this during your school hours? And make it open to everybody in the school that can watch it and participate. So these are just some suggestions.
So we actually, and we also, what we ultimately came to the conclusion was that we had to make sure that we provided youth a platform that they were comfortable with, but also that would not be accessible to folks that would maybe want to cause harm. We know that there's been Zoom for a while was getting hacked when all of this started, and there was concerns about Google Classroom. And so we were trying to take into consideration all of these different factors. And ultimately what we ended up doing was using WebEx. And we talked about giving first priority to our youth who were in residential psychiatric treatment facilities. And what we did was really work with our partners to make sure that those youth knew that they had priority to participate. We were not, as engagement staff, we were not part of that marketing. So there was that separation between our staff and those who were actually working directly with the youth who were getting services. And then we partnered with our Department of Public Instruction to send it out through guidance counselors. And then as a parent myself, I went into my Facebook mom groups and on social media and posted it there. We tried to do as much as we could to engage in the community to bring folks back. I'm going to go back one more slide. I do think that one thing I want to mention with the accessibility, we talked a lot about the actual platforms and the broadband issues, but we also recognize that there are youth who have financial issues. We know that some of the youth in our state, they may not live in a house or a home, and so there's a comfort level that we needed to be aware of. And we knew that this would potentially expose a lot of inequities that I think as a system we know are there for families, but would potentially highlight that even more. And that was something we all kind of thought about. As far as how the youth were identified, we needed to limit it to the 3 service categories that our division serves, which is mental health, developmental disabilities, and substance use disorders. And we connected with the agencies outside of the division to help, and our next slide will show that, to help us recruit. We decided to limit it to 2 kids per each, or 2 youth per each service category, in order to have about 6 panelists that would help lead a conversation with our deputy secretary, who is now chief deputy secretary for behavioral health and IDD. And really, we also needed to do a lot of consent forms. That seems like a silly thing to mention, but it was really important that we got consent from youth participants. If they were under the age of 18, then we asked that a family member, a caregiver, or a family member parent sign for them or with them. So we did want to make sure that the youth were informed. So we did a training, but also that they knew that some of the event itself would be broadcast on YouTube, and that it would also be live on Facebook. So are you okay, Stacey?
Yep, everything just disappeared.
Oh no.
I can hear y'all, but can't see anything.
Gotta love technology. Do you want me to keep going, or you want
Nope, I can do it because we're on the slide is, oh, there y'all are.
Yeah. I'm
going
to finish up with talking about healthy transitions.
Okay.
Healthy transitions is a substance abuse and mental health services, or SAMHSA, funded initiative that focused on transition age youth 16 to 25 who identify as having a serious mental illness, or a serious emotional disturbance. And it's a 2 pilot counties to help identify ways that are to engage with youth to capture their authentic voice. We really leaned on those project leads to help us understand better how to engage, but also to help walk us through this process of, are we asking interview questions, or are we allowing the youth to ask interview questions? What is the process? We also worked with healthy transition staff to really develop what the consent form needed to look like and what needed to be in place. Because as adults, as Stacey said, we have our adult thinking caps on. We weren't thinking about what would work best for youth. We also tried to use Mentimeter, and I'm going to get to that in the next slide, in a couple of slides. So I'm going to go to the next one. And
So
Stacey,
these are just a few of our community partners that we partnered with for our teen town halls, and they're the ones who helped us with getting out the information, getting the youth to participate. You just need to reach out, just make sure that you're hitting all disabilities. If that is your goal, to have more than one disability. Like we said, we covered all of ours, which is mental health, substance use, and developmental disabilities. You want to make sure that you're your local resource, that you're using your local resources, not just totally all state or all like NAMI or North Carolina Families United. You want to have a wide variety. You want to throw your net out so that you can get a wider base, and you'll reach more people that way. They'll bring different resources to the table also. So spread the work around. There is a lot of work in getting this done. So get partners and say, hey, can you handle this section? With doing this, you also, like I'm monitoring the chat, which is why everybody just disappeared. So, you could have one of the groups monitoring the chat, but also with doing town halls or any kind of group session with youth or teens or young adults, you may hit areas that may trigger them. Some subjects may trigger, and you want to make sure that you can have counselors or people reaching out to the participants to make sure that the next day that they're okay, that if there was anything that triggered them, that you're just not leaving them out there to try and work through it on their own, that we don't do any more harm than what is already there. We make people better than when we reached out to them. We don't want to hurt anybody any worse. So we want to make sure that we provide them with resources, and your partners can do that with you and for you in a lot of cases.
Yeah, and I think that's a really good place to say that one of the things we did make sure we had a slide deck. We didn't really need it, but we did make sure that all of our volunteer clinicians from these agencies and our chat monitors all had access to a list of resources that if they needed to follow up with a participant in real time, they had those resources available to them. And we actually did include what we provided in this slide deck. What we did do, we ended up sending that out to everyone. That way, if somebody said, during the event, I was okay, but now that I'm thinking about it, I'm not feeling so great. One of our resources that we've leveraged in North Carolina is our Hope for NC line. And that started out on the eastern part of the state in response to some of the hurricanes, really creating a database and resource for resilience and resources for mental health and behavioral health needs. And because of the pandemic, the state was able to expand it statewide. We also added a chat feature. We know that youth prefer to chat and text. They don't like to make the phone calls necessarily. And so that added feature has been a way for youth to really get those resources they need. I'm going to go to the next slide. I want to monitor time here. So this is an image of Heart's Ladder. And if you could use the chat, I know some of y'all already used the polling questions in Whova to let me know, let Stacey and I know if you have seen or heard of Heart's Ladder, which is Heart's Ladder of engagement. So I'm seeing no. Okay, well, while I talk about this, you can continue to use the chat, use thumbs up. So I was introduced to Heart's Ladder of youth engagement because of the Teen Town Hall. I had not heard of it before. One of our youth peers sent it to me and said, have you heard of this? And I said, no. No. But the image really resonated with me. And the more I read about it, the more it made sense. So when we started, so Heart's Ladder is really the different levels of how we engage with youth and young adults, where the bottom rungs are really the non-participatory levels of engagement, where we're really telling youth, here's what we're doing, here's how you're involved, and not giving ownership or leadership opportunities to our young adults and youth in the community. I think where we landed is really, we kind of landed in that 3-4, where we started out with tokenism, where we would have youth present. We assumed that youth would just love to speak with our chief deputy secretary, or the Secretary of Human Health and Health and Human Services. We thought, oh yes, they would love to just talk with, but the more I thought about it, I was like, that may not even be on their radar. We know who those people are, and we know that they're important, especially when it comes to the pandemic and responding to the pandemic. But they may not know, and they may not even care. So what is the incentive for youth and young adults to participate in something like this? And we recognize that in that level, we were tokenizing youth. We were not giving them any incentive to participate. We were assuming that they would want to, and it was almost performative, right? That does not give me the warm and fuzzies when I think about where we started with this particular project. So I really appreciated this visual. Ultimately, I think we kind of got up into the 6-7 range. And I'm going to talk a little bit more of that, how we got there. Ideally, we would like to start out at level 8. That is a great place to be. And how do we do that? I think when it comes to an event like this, we need to step back and say, we can't just pick a topic for young people to talk about. We need to know what youth want to speak about. What is it in their lives? It may be something, the pandemic is one thing, but we know the pandemic maybe triggered other things that happened in their lives. Or maybe we had youth who were not in a good place at home, and school was their safety net. So we need to figure out what it is that youth want to talk about. We need to start with the opportunity for leadership and saying, okay, we'd like to do this. We don't know what it's going to look like. Let's recruit some young leaders to be part of the planning process and to start with a focus group. Now, how do you avoid tokenism in this, right? And how do you provide incentive? I think the best way to provide incentive and to avoid that tokenism is to pay the youth as the experts that they are. In our state, we have consumer and family advisory committees that have a per diem they get from the state or from their local management entity or managed care organization to provide feedback to those agencies. And they are paid a per diem to do that. There are some different issues that you have to face when you're trying to give a stipend or a per diem to young adults and youth. Because of labor laws, and because as state agencies, we would have to register each individual as a vendor. And that is just a lot of paperwork. And so finding one of your community partners that is able to provide that stipend or that per diem, or to assist in a way with providing the incentive, the financial incentive to participate, is one way to ensure that you're not tokenizing youth, and that you're giving them an incentive to participate that is valuable to them. At the same time, setting aside funding if you're a government agency, and trying to look from the policy standpoint of, can we make this a policy going forward? We're still in the process of figuring that part out and how we can do that within our legal means. We did partner with Youth Move, North Carolina Youth Move, who provided compensation to our panelists for sharing their story and going through that emotional labor. That was awesome, and we are so grateful for the opportunity to work with them. We did realize during this presentation, or during this town hall, that when things were youth-led, there tended to be an emphasis on school-related issues and how COVID impacted their educational goals, and as well as the impact on isolation and the lack of socialization that COVID had on them. I don't think we anticipated that, right? We thought they would talk about anxiety. We thought they would talk about vaccination. You know, initially we had thought they're going to ask about when can they get the vaccine, but that's not what came up at all. And it was actually very helpful to reframe our minds to understand that kids' lives, when they are that age, revolve around what they do from a day-to-day basis, just like our lives revolve around work or our families. Kids' lives revolve around school, and their schoolwork is important to them. And those are expectations that we have as adults, we have set for them. And so it's a really, really great conversation. I'm going to go ahead. Stacey, do you want to talk about establishing the ground rules?
Yeah, I'll do the creating a brave space.
Mm-hmm.
So what you want to do is create a brave space. Had a little trouble with my R's today. And what that means is it's a judgment-free zone, let's say. So you want to make sure that you're actively listening, or another way of looking at it is non-judgmentally listening. And everybody goes, oh, I listen all the time. I'm a great listener. But are you really? Think about when you're having a conversation with somebody, are you really listening, or are you already forming what you're going to respond to that person about? 90% of the time, we're already coming up with what we're going to say, and we're missing some of the true meaning of what they're saying to us. We're getting a gist of it, but we're trying to come up with the best thing we can say. So it's a lot of practice goes into active listening, non-judgmentally listening. So that's something that, you may need to practice on, and just make sure that, you're open to that you're able to, if the youth or the young adult is telling you their story, that you may paraphrase it back to them so that you can make sure what you're hearing is what they're actually saying. And if it isn't what they truly meant, give them time to reframe it and let them, so they can express themselves, that they you and them both are on the same page. Engage in self-awareness and self-care. That's something that I think across the board with the pandemic, we're all having to learn. I know there are days that I'm on some form of Zoom meeting from 8 in the morning to sometimes 8 o'clock at night. And you're just like, I need 5 minutes. I just need 5 minutes because I have to go to the little girls' room. So we need to make sure that we're taking our self-care, but we're also providing self-care for the people that we're working with, the youth, the young adults. And it's okay to take a break. It's okay if in the middle of their story, you're noticing that they're becoming upset or they're having trouble articulating. Just say, you know what, let's take a step back and get a cup of coffee, because kids drink coffee now. Water's better, but I'm sure they drink coffee. They're not going to turn down Starbucks. So get a Coke, get a water. Just take 5 minutes so that they can regroup and you can process what they're telling you, because sometimes it's very hard for us to hear their trials and tribulations that they've gone through, because sometimes their stories, their life experiences are something that we've never had to deal with, and it's it's very hard on us. So make sure you're doing self-care. Make sure that you're allowing your time and them to function so that you can take that break. Remember that it's okay to ask for help. Make sure that you let them know that. Make sure that they know that they can reach out for help. Just like we were saying, we had the Hope for NC information on our thing. Make sure that you have what is working in your state. Make sure it's a judgment-free conversation. Sometimes in order to get a story out, people have to use words that may not be appropriate in a social setting. Sometimes it's like I like to say, it's like getting all the garbage out before you get to the story. If you stop them from that, you may never hear their story, and you may never find out who they are and what they've been through. Sometimes you just have to, no judgment, allow them to speak and give them the time that they need. And once again, make sure you stress how much it is a brave thing to ask for help. Even after you have your town hall or your group meeting, make sure that they know, here's the numbers you can reach out to. Here's my email address. If you feel more comfortable reaching out to me, I'll make sure you get set up with whoever's the most appropriate person. Make sure you have that safety net, and that there's no stigma in asking for help, because in our world today, there is a lot of stigma out there, especially with asking for help. You can go to the next slide.
Thank you. And this is actually the exact slide that we used in the town hall at the beginning, just letting the youth know that, this is what we mean by a brave space. And so it is, we do share this as kind of the common, when we start meetings, even sometimes our meetings are brave spaces. So come with your authentic voice. So I'm going to talk a little bit about moving away from that performative type of allyship that I talked a little bit about a couple slides ago, where we started when we thought we were doing something really great and really innovative. But what we really found was that it really felt more performative in nature. So really, to be an effective adult ally to youth, it's less of an action and more of a behavior. An adult ally is a trusted partnership between an adult and a youth, where the adult prioritizes the youth's interests and their voice before their own. They provide guidance, but encourage and allow youth to lead. Again, going back to that brave and safe space, but also being responsive to the group's needs and asking for participation. And then being genuine and authentic when you follow up. A lot of us that work at the division have lived experience with mental health or substance use disorder, or even developmental disabilities and TBI. And we lean in on that. Experience to let folks know, whether they're a youth and young adult or an adult, or even into our aging population, that we know, we get it. We've had similar experiences, and it doesn't mean that your experience is any less valid. And really moving into that affirmation space. I think a lot of that happened really naturally, and hopefully you'll see some of that if you get a chance to watch the full Teen Town Hall. You'll see where the youth really step up, they advocate for one another, and I'm getting ahead of myself. This is when we talk about outcomes, I just get so excited about it. But really moving away from what it means to be a performative ally and moving into that authentic allyship. And as you do that, as we move into authentic allyship, we're really moving up the rungs of Heart's ladder. We're encouraging youth to use their voice and really amplifying their voice so that they know it's important. What you have to say is important. And rather than telling them, just as you wouldn't to another adult, we need to affirm that youth are having these experiences and that they are important, and that they are valid. So this is where we talk about the outcomes, and then we're going to get to the clip. So in the moment, the youth really, they had no formal training. Some of our volunteer panelists did have some training. A couple of them were skilled leaders in youth peer advocacy and peer supports, but a lot of our participants on the call were not. A lot of them were just kids who had learned about the event and wanted to participate. And I shouldn't say kids, they were youth who wanted to participate. And in the moment, we had a lot of the youth panelists and the youth in the chat step up and say, we really want to speak. Initially, we had planned it so that just the 6 panelists would be the 6 speakers, and they were speaking on behalf of their peers. But that didn't work out. And going back to that flexibility, we had to be flexible in the moment. We realized that we weren't really being very ethical in silencing the voices of the youth participants. And so one of the panelists, Ryan, asked, she said, hey, we've got a lot of people making good comments in the chat. Can we unmute them? And Chief Deputy Secretary Kinsley said, yeah, absolutely. Everybody, if you want to say something, we'll just take turns and we'll unmute. The conversation went, it was only scheduled to be an hour, but we were there for an hour and a half that day because
it could have gone much longer.
It really could have. The youth really felt like this was an opportunity for them to have a platform to speak with somebody who has an influence on public policy, who can make changes for them. And it was really wonderful and empowering to watch the just the natural peer-to-peer support unfold. Youth who were sharing that they had really difficult moments during the pandemic where they felt really alone. They shared that they felt like, some of them said they felt like the pandemic was preventable. And this was in February of 2021 that this was held. And they felt like where we were then could have been prevented. And so you got the sense that there was some anger there. And they talked to each other about it. And they affirmed one another's experience, and they said, yeah, I felt that way too. And I was really upset because I was supposed to graduate from high school and it wasn't what I thought it was going to be. And so the authentic moments that happened, and I'm getting like goosebumps just talking about it, they naturally fostered that affirmation that we want so badly for each other. They naturally fostered empathy. Two of our youth panelists were also on the autism spectrum, and one of them was deaf and hard of hearing. And we had an interpreter. We also had closed captioning to make sure that our deaf and hard of hearing youth were able to participate. And you could see inclusion happening in the moment. We talk a lot about community inclusion as adults, but children and youth, they already kind of understand how to be inclusive. And so it was really great to see that unfold. We did have a couple of things happen, and in retrospect, I wish that we had thought through this a little bit better, but this is where we need our youth leaders to help us think through this. A lot of our youth decided to connect via Nintendo Switch, and I did not know that you could do that. So they were giving each other their Nintendo codes, and we realized, okay, one, it's good that this link is protected and it's just for the youth participants, and that this is not being broadcast live on Facebook or YouTube. But two, maybe going forward, we probably need to have something in place that says, if you want to connect offline, we'll help you do that, but please don't share your personal information in the chat.
Yes.
So that there was a lot of that. Stacey did talk about the follow-up calls. We had one young person make a comment about calling the suicide prevention line and not being able to reach anybody. And so that person was able to receive a follow-up call from one of our clinicians. Stacey, could you talk a little bit about Mentimeter? Or do you want me to do that?
Because I've never used Mentimeter.
I haven't either. So that was another thing that we were introduced to. It is a live engagement tool. You can draft questions ahead of time. We thought that the youth were not going to talk. We assumed that they're teenagers. You know, the age group that we really targeted was 12 to 19, and we thought we're going to have questions. These young people are not going to talk. They're not going to share anything. And we were very, very wrong. We had initiated, we thought we were going to need to initiate that to just break the ice and get folks talking. Didn't even have to do it. We just crossed that right off the list. And what we ended up doing was using some of those questions because it was our real-time survey. We ended up using that to draft questions to do a post-event survey. Unfortunately, because we weren't collecting data in real time, and young people really are more in tune to real-time data collection and real-time engagement, we had about 8 responses to the survey. It wasn't even out of the 150 young people that participated, or I can't even remember the number of.
Yeah, we had what, six to eight. So if you're looking at getting data, you need to do it during.
It's definitely more effective to do it during whatever you decide to do. Real-time engagement is the way to go. So now I'm going to share with you the clip. This is Elijah, wonderful youth leader in our community.
He is amazing.
He is amazing. I'm going to share what he shared during the presentation.
I'm feeling, of course, scared every day as to what could happen, but I'm also feeling optimistic because of the fact that this is a wake-up call. This whole process, this whole pandemic has been a wake-up call for our state legislators, our state administrators, our school administrators, our district administrators. It's a wake-up call because of the fact that saying that state administrators, our school administrators, our district administrators, it's a wake-up call because of the fact that saying that there needs to be more resources in and outside the school. There needs to be more, resources for transportation, for folks that don't learn the same. There needs to be more guidance counselors. There needs to be more resources regarding technology and people who don't have access to technology, more transportation resources, more food resources. And so I think it's a wake-up call in the hardest way possible, very heavy-handed, but I think it's definitely a wake-up call.
So that was one of those moments that if I had to pick any from the hour and a half of conversation, that was one of the wow moments. Because as he said, he saw the big picture. He can see the big picture. It's not just things that are happening in the school systems. It's things that are happening outside of the school, where our youth need more supports. We know youth need social determinants of health supports as much as adults do. And he really brought that home. And that was the clip that if I could share that with any sort of policymaker, that's the clip I would share. Hopefully you'll get to watch more of it. But let's move through the next.
I'm feeling, of course, scared.
Sorry, I'm not sure why it's playing again.
But I'm also feeling optimistic because of the fact that this is a wake-up call.
Okay, my apologies. It did play for everyone, right, Stacey?
Yes, I heard it.
Okay, good. There we go. Okay, my apologies, technology. All right, so as we close up, because we are at our hour, we've reaffirmed this several times, really including youth participants for future events, having it be youth-led. We really believe that starting with the youth involvement will be less performative and more authentic. We also know that when youth lead these types of events, these engagement events, they are more authentic and they do capture the voice of youth better than if adults were leading it. We're moving really away from right now. We're not really looking at, let me rephrase that. We're looking at doing some town halls in the future. We were asked to do more town halls by the youth, but we want to make sure that we can provide that that incentive and that per diem, or a way to ensure that we are not tokenizing our youth in these types of settings. We also had the involvement, the Division of Public Health within the Department of Health and Human Services in North Carolina does have a youth health advisory committee. Some of those youth have identified mental health issues as an important topic to address, and we have been able to partner with them. But really, if we can start looking at ways to bring youth into our state and community collaboratives, and that is linked here in this PDF that we'll send to you, as well as our state and local consumer and family advisory committees. Those are the committees I mentioned before that really provide important feedback on the service delivery system, on what's working well and what's not working well. Taking that notion of nothing about us without us and saying this applies to our young people too. We need to hear from youth and that age group that we say you need these services, right? We need to hear if it's working or not from them. We can't just assume. We need to elevate the voices as much as we elevate adult voices. Really starting that practice of dignity of risk and self-determination at a younger age. Obviously, we need to do things within reason and safety, but when we give our young people a chance to make those decisions and to advocate for themselves, they rise to the occasion. They may stumble along the way, as we all do. Nobody is perfect, but it's another way for young people to learn and to really be empowered. And that's what we are going for. it's hard to be an empowered adult if you're not empowered as a youth. So I think that's really what came out of this this event, the town hall. And going forward, I think we really want to kind of, well, these are reflection questions for the group, but really going forward, what can we do to foster youth as the leaders in these engagement opportunities rather than being passive participants? I don't know if Stacey, if you want to add anything, or if we can open it up to conversation.
I think another way of looking at it also is not only encouraging the youth participation, but for us, that the adults, is to be able to accept their ideas.
Yeah.
Because some of them may be very challenging to us because they're coming from a mindset that we don't have. And so we have to be more open to new way of doing things.
New ideas.
New ideas.
Somebody suggested TikTok to me once, and I thought, oh my gosh, but that's where young people get they get information there. They're the Instagram influencers. That has an impact on our young people's lives, and how can we leverage that in a positive way to have more
Only thing I see chatting in the chat is about apple cider, which is just making me want some apple cider at this point.
So if anybody, I think this is where we can open up for conversation. Just some reflection questions. I think there was one question that we had that came in from Huva about connecting with different community organizations, and the best way to do that. So in our division, we have a child mental health or child behavioral health team. And the department is actually looking at standing up a new division of child and family well-being. And that will include not only children and youth behavioral health, but also children with developmental disabilities. It will include women, infant, and children. So some of that early intervention pieces, they're still kind of forming the organizational components to it. But connecting first within, if you're coming from a state government perspective, connecting first within your agency to child and youth teams or agencies, departments, however you designate that. And then looking to see in your community, what are the youth-led nonprofit groups or non-governmental agencies, and start a spreadsheet and put down who are the best people to contact from those different groups. Reach out to them and have conversations about doing something like this. Or if you're looking to form an advisory board, whatever may be in place for adults, consider replicating that for youth and making sure that you're leaning in on resources that promote youth voice as leaders, above that, on maybe that 7, 8, hopefully 8 rung of Heart's ladder, where they're not being tokenized, but they're really being heard. And I think the other piece is we work a lot with our adults on this, is when advisory pieces are made, we talk about solution-oriented recommendations. So if there's a problem, please identify the problem, but also if you think of something that could help solve the problem, let's include people in the problem-solving piece too. That gets that buy-in. It gets that that feedback is implemented. It's more personal. It's driven by the person who needs the support.
You've also got to put aside the territorial. This is my company or my division does this and this one over, and we can't cross. Well, yes, you can, and you can work together. You just got to put that aside, even when you're dealing with private companies. Mm-hmm. You got to meet and and just sit down and have a conversation and come up with the game plan that for you to be able to meet the goal that you set. And I believe you'll get buy-in.
Absolutely. That's true. We had a very rich conversation. So we do have a few minutes for questions. We're wrapping up, but I would love to open the floor to questions, comments, reactions. Are you thinking about watching the full town hall? Get some popcorn and tissues if you do. Anybody thinking about getting a cup of warm apple cider or hot tea? Okay. Well, if you think of anything, and hopefully we covered all the questions that were posted in Whova. If you think of anything or you'd like to reach out to us, and I apologize, I did not update your email, Stacey.
I saw that. I'm like, who is Rachel?
Oh, it's my other co-presenter. I apologize.
But you just take my name, like as Kate's email, and you put my name where Kate's email is, name is, and you'll get my email.
Rachel is the wonderful person from Healthy Transitions that assisted with.
And that's not my phone number either.
Nope, I recognize that, and I apologize. I thought I had updated that, but
So if you need my phone number, it's 919-604-6027. We'd love to hear from you.
Flexibility. Thank you for
Definitely.
being flexible. So if that is all, we don't have anything else to share. I hope everyone has enjoyed this session.